I'm going to invite the audience to think about this with me for a moment. How many times in a single day do you hear the words, "Doc, I'm all out of energy"? You hear it from your patients, you hear it from your clients. Sorry? What you need? All set? Okay. Thank you. So you hear from your patients and clients, maybe you hear from your friends, your colleagues, maybe you hear from your family members, maybe you even say it yourself many times a day. Now, what does that tell you? Now, we heard a little bit earlier today about the fact that when we look at the energy being put off by devitalized tissues, that all of a sudden the amount of energy coming out is far lower. So when people say they don't have any energy, they're actually telling you what's really going on. They actually do have a devitalization going on. One of the things that I would like to do today is I'd like to take a few moments to talk to you about energy from a slightly different perspective. But before we go there, I'd like to take care of a little bit of housekeeping, if we might. First of all, my purpose today is actually threefold. I intend to share facts with you, and these are not conjecture. Dr. Dawson Church basically just showed us a whole litany of different research that has been done, and I won't repeat that process, but I do really encourage you to realize that all of this is absolute fact. The second thing I'd like to do is I'd like to share with you why I believe that the incorporation of energy medicine into the practice is absolutely crucial. For me, the practice of medicine without the use of energy medicine doesn't make any sense. I know that ever since I've incorporated it into my own practice, I couldn't even imagine seeing a patient without using it. How do we advance this one? This one here?
Yep.
Got it. Before we go on any further, let's make a few agreements. In a one-on-one type of situation, like in an office, for instance, I can look into a person's eyes, and it's very easy for me to tell whether or not I have their attention or whether or not I've just lost it. In an audience like this, that's absolutely impossible. So periodically, I may actually say something like, "Is that clear?" And if it is, I just ask you to say, "Clear." Let's try that once. Is that clear?
Clear.
Thank you. And if it's not, what I'd like you to do is I'd like you to just gently raise your hand and be sure and jot your question down, because at the end we're going to answer those questions, and if not, because we don't have the time here, then we'll do it out in the hallway. Also, I would ask that if you have questions that are very personal and or something that is confidential, try to keep those to yourself and don't even ask me privately, because I can't really answer those in this setting. And then thirdly, I'd like to make one other agreement with you, and that is this. If you haven't been motivated by everything that you have heard today, I would be stunned. But if you have been motivated, make sure that you've gotten the tapes so that you can listen to them over and over again. Make sure that you share them not only with your patients, but also with your family, your friends, and other colleagues. We need to get the word about energy medicine out. It's been a secret far too long. Okay. So, let's go back to where we are. Well, as Jim said, I was originally trained as an ophthalmologist, and so I went to medical school, and then I went on to become an ophthalmologist. And in 1982, I had been in school for 25 years, and I figured, oh, thank goodness, I finally made it. So I thought. And what happened was that about 3 years later, I went to see my surgeons and my physicians, and I said to them, you know, I'm just not feeling right, and I'm not sure what's wrong. Well, they did a much more thorough workup on me than most of the physicians had over the 35 years of my life at that point. And what they found out was that I had a brain tumor about the size of a fist. And it was in my head, right at the junction of the brain and the spinal column. Now, it was enough to hear at that point, well, your surgical career is over. And oh, by the way, your life may be too. I just couldn't believe it. Well, as it turns out, what I did was I actually went and I started to investigate ways that I could try to help myself. And one of the things that I did was I called the chairman of the Department of Ophthalmology back at University of North Carolina, where I had trained, and David and I had become good friends because we had done research together as well, and he said, let me find you a couple of good brain surgeons. One was a professor of brain surgery at Pittsburgh University, Dr. Peter Janetta, who had actually pioneered many of the operations of the posterior fossa. Another one was a surgeon in Switzerland, but his costs were just totally out of control, and so we didn't even think that one. So I also went back and I interviewed the chairman of the Department of Neurosurgery, whom I befriended when I was a resident there. And he said to me, I would love to help you, except that I'm going on sabbatical and I won't be around to help you. So then I did the unthinkable. I went to the guys down the street at Duke University. And it's fascinating because time after time I had spoken to different surgeons and they said, well, yeah, we can do surgery, but prognosis doesn't look very good. You'll probably come out a quadriplegic or maybe even worse. So I didn't like those odds very well. And then I walked into the guy at Duke and he threw my pictures up on a light box and he said, what are you guys drinking in the water in eastern North Carolina? I took 2 of these out last week. And I was stunned. I said, you really think you can help me? He said, absolutely. What I'm trying to get across to you is confidence. The idea of confidence is so important when you're dealing with patients that you really need to focus on being confident. First, you have to be confident of yourself and what you know, and then you have to display that confidence to your patients. So, what we did was we went out and did an operation. And after spending 9 hours in my head, he came out and he said the following. Well, we debulked the tumor from about the size of your fist to about the size of your thumb. But you were awake during the operation, and the nurses were watching you from all different kinds of standpoints, and one of the nurses noted that at some point your left eye started to drift up and outward. And that was my signal that I had just injured the nerve to the extraocular muscle of your left eye. So the operation ceased, and there was nothing further that could be done surgically. Well, in the world of cancer therapy in the United States, there were really only 2 other options at that point, chemotherapy and radiation therapy. So we interviewed several chemotherapists, not only at Duke, but also at Mayo Clinic, and what they said was basically, yes, there are several different types of chemotherapy agents that we have. The challenge is that your tumor is so rudimentary and is so resistant to cell therapy that chances are we would do an awful lot of damage if we tried to use those agents, so we wouldn't recommend them. So we went on to the radiation therapist and they said, yeah, we can fry that, but chances are you'll be a quadriplegic or maybe even worse with all the collateral damage. So that wasn't an option either. So after conferring with my wife and my surgeon, what we decided to do was none of the above. What my surgeon said to me was, he said, look, you're 35 years old, and with the rate of research that's going on in neurosurgery now, for all we know, we'll have some kind of super-duper stereotactic operation, or we may have some kind of smart bombs that we can actually label and send into your body that will only take out tumor cells and nothing else. So I wouldn't do anything. This thing is likely to come back, and we don't know how quickly that's going to happen, but I wouldn't do anything at the present time. So that's what we just chose to do. So for 9 years, every year, I went back and I had another MRI scan. And you could literally take one picture and put it right on top of the other one the year before, and they never changed. Tumor didn't get bigger, but it sure didn't go away. So after 9 years, after doing some studying into magnetics and what that could do to your body, I chose not to do that. You heard about it this morning. Magnetic radiation isn't that great for us. So at that point, I went out and really started to do only office work. I could only work 3 days a week in an ophthalmology office. I certainly couldn't do any surgery. And I became something of an expert in medical ophthalmology. However, at that point, I also opened my mind to what was going on in my wife's life, because actually she had come down with what they used to call yuppie plague or chronic fatigue syndrome. Nobody really knew what was going on except that she had fevers on a daily basis that would run probably 4 to 5 degrees hotter than normal, and that she had a positive antibody to the Epstein-Barr virus. So of course everybody just labeled it Epstein-Barr, there's nothing you can do, and they just wrote it off. Well, neither one of us was very satisfied with the situation from the general medical profession, so I decided to take it upon myself to start traveling. Between 1994 and 1997, for 2.5 years, every 2 weeks, I was on a flight somewhere from Florida in this country to go learn at the feet of the giants. Meetings like this, listening to people like Jim and Dr. Kessler and others. So I would do that every 2 weeks.